Today, I will explain gastritis in detail. 1. Definition of gastritis. Gastritis refers to a condition in which the gastric mucosa is damaged and inflamed. The gastric mucosa is the part that surrounds the stomach from the inside and comes into contact with food, and it protects the stomach wall from gastric acid and various digestive enzymes. When the gastric mucosa is damaged and the surface becomes loose or wounded, inflammation occurs. 2. Types. Gastritis can be divided into acute and chronic depending on the time it occurs. In addition, there are classifications based on histological findings, anatomical distribution, and pathophysiological characteristics. Classification of gastritis. 1. Acute gastritis. Acute gastritis is an acute inflammatory change in the gastric mucosa, and it occurs when gastric acid secretion increases and blood flow to the gastric mucosa decreases, destroying the mucus layer attached to the gastric mucosa and directly damaging the epithelial cells. It often occurs immediately after exposure to various drugs or substances that damage the gastric mucosa, such as aspirin, painkillers, or alcohol, or when blood flow to the gastric mucosa is reduced, trauma, burns, sepsis, etc. When an upper gastrointestinal endoscopy is performed at this time, swelling of the mucosa and dot-shaped bleeding are observed, and in severe cases, the mucosa may be peeled off or inflammatory exudates may be observed. Acute gastritis can also occur due to Helicobacter pylori infection, and in this case, symptoms such as pain in the epigastric area and nausea and vomiting often occur suddenly. When observed microscopically through a tissue biopsy, neutrophils are infiltrated into the tissue and tissue swelling is observed. Infectious gastritis caused by various bacteria or viruses can occur in elderly patients, alcoholics, or patients with acquired immunodeficiency syndrome (AIDS). In particular, in cases where bacterial gastritis or purulent gastritis occurs, it can be life-threatening, although rare, if appropriate antibiotic treatment is not administered. Other types of infectious gastritis can occur in patients with impaired immunity, such as patients with acquired immunodeficiency syndrome or those receiving immunosuppressive therapy, and in these cases, herpes simplex virus or cytomegalovirus is the cause. In addition, common causes of acute gastritis in Korea include anisakis infection after consuming raw fish or corrosive gastritis caused by strong acid or strong alkaline solutions. 2. Chronic gastritis. Chronic gastritis is a chronic inflammatory change in the gastric mucosa, and is defined as a condition in which inflammation persists for a long time, resulting in atrophy or hyperplasia of the gastric mucosa and metaplastic changes in the epithelium. Histologically, infiltration of lymphocytes and plasma cells is observed, and this infiltration of inflammatory cells is initially limited to the upper layer of the mucosa and around the gastric glands. As inflammation progresses, structural destruction occurs, followed by atrophy of the mucosa and intestinal metaplasia. If we look specifically at the stages of chronic gastritis, in the early stages, inflammatory changes are observed only on the surface of the gastric mucosa, which is called superficial gastritis. When this inflammation spreads to deeper parts of the mucosa, the structure of the gastric glands is gradually destroyed, which becomes atrophic gastritis. When an endoscopic examination is performed at this time, the mucosa becomes very thin, and blood vessels become visible. As atrophic gastritis progresses, the structure and shape of the gastric glands in the mucosa gradually change to resemble those of the small intestine or large intestine. This is called intestinal metaplasia, and it is thought to be a precursor lesion of gastric cancer. 3. Symptoms. When gastritis occurs, various symptoms such as abdominal pain, mainly pain in the upper part of the abdomen, indigestion, flatulence, and nausea may appear, and there are many cases where there are no symptoms. In addition, since these symptoms are not characteristic of gastritis, it may be inaccurate to diagnose based on symptoms alone, so caution is required. In the case of acute gastritis, sudden pain in the epigastric area, nausea, and vomiting occur. In these cases, it is often the case that painkillers, anti-inflammatory drugs, alcohol, or spoiled food were consumed before the symptoms occurred. In the case of chronic gastritis, there are often no characteristic symptoms. Since many patients complain of upper gastrointestinal symptoms such as indigestion, it is often difficult to distinguish it from functional dyspepsia clinically. Symptoms of functional dyspepsia include upper abdominal pain, abdominal distension, early satiety, and nausea. 4. Diagnosis and examination. Since there are no symptoms specific to gastritis, it is necessary to see a doctor if you have symptoms such as indigestion, epigastric pain, nausea, and heartburn. In particular, Korea has one of the highest incidences of stomach cancer in the world, so it is always necessary to check for stomach cancer. Depending on age, gender, family history of stomach cancer, previous endoscopy date, lifestyle, and whether or not there are warning symptoms related to stomach cancer, difficulty swallowing, persistent vomiting, weight loss, evidence of gastrointestinal bleeding, an endoscopy may be necessary first, so you should avoid arbitrarily diagnosing or prescribing medication. There are also cases where patients want to undergo an endoscopy unconditionally, but even though an upper gastrointestinal endoscopy is a safe test with few complications, it is better to avoid unnecessary tests. If the endoscopy results show no ulcers, cancer, etc., and only mild redness and other non-specific findings, a diagnosis of gastritis is usually made. A biopsy is sometimes performed, and in some cases, a diagnosis is made based solely on the endoscopy findings without a biopsy. 5. Treatment. Whether to treat gastritis is determined by comprehensively judging the endoscopy results and the patient's symptoms. Treatment is also necessary in cases where the endoscopy findings show only mild gastritis, but the symptoms are severe, or in cases where the endoscopy findings show severe inflammation even if the symptoms are not severe. Treatments include drugs that suppress gastric acid secretion and lower the acidity inside the stomach, agents that enhance the defense factors of the gastric mucosa, or agents that regulate gastrointestinal motility. Although there is no evidence that patients with chronic gastritis secrete more gastric acid than normal people, drugs that lower the acidity of the stomach, antacids, are most commonly prescribed. These drugs include proton pump inhibitors, potassium-competitive gastric acid secretion inhibitors, and H receptor blockers. In cases where symptoms such as early satiety or postprandial bloating occur, additional gastrointestinal motility regulators are used. In addition, defense factor enhancers that protect the gastric mucosa are often prescribed together. Frequently asked questions. Cue the endoscopy results say that it is nervous gastritis. A. When gastritis is found in an upper gastrointestinal endoscopy and symptoms do not improve despite continued treatment, the term nervous gastritis is commonly used because it is considered to be neurogenic, but the term nervous gastritis does not originally exist. Since gastric motility and acid secretion are controlled by the autonomic nervous system or the cerebrospinal fluid, symptoms such as indigestion occur when the physiology of the stomach is affected by stress or emotional stimulation. For example, when suddenly experiencing sadness or worry, appetite decreases and digestion is a similar phenomenon. In such cases, the term functional dyspepsia is appropriate. I have chronic gastritis in my endoscopy. Is there no way to cure it? A. As the term chronic gastritis suggests, chronic gastritis is not something that occurs suddenly, but rather develops gradually. It can be caused by eating various types of food, spicy food, salty food, burnt food, etc. From birth, irregular eating habits, Helicobacter infection, etc. In addition, as we age, the stomach mucosa also goes through an aging process. Therefore, it is impossible to return the chronic gastritis condition that has developed in this way to the normal stomach condition at birth. It is like it is impossible to return the wrinkled skin of a 70-year-old grandmother to the elastic skin of a 20-year-old. For your information, the stomach is always stimulated by various foods and stress, so there is a certain degree of gastritis. In such cases, it is diagnosed as physiological gastritis, which is a normal finding. If chronic gastritis persists for a long time, will it lead to stomach cancer? A. Chronic gastritis occurs due to various causes. As far as is known, chronic atrophic gastritis and intestinal metaplasia are thought to be precursors of gastric cancer, but not all of these patients develop gastric cancer, and in fact, very few develop gastric cancer. Therefore, there is no need to worry that chronic gastritis will lead to gastric cancer if it continues for a long time. It is sufficient to have regular endoscopy once every 1 to 2 years while maintaining a healthy lifestyle, quitting smoking, eating regularly, and exercising appropriately. Should I eat porridge if I have poor digestion? A. Except in very special cases, there is no need to eat porridge for a long time. In general, it is customary to tell patients to eat porridge unconditionally if they have poor digestion. They tell patients to eat porridge without any time limit, but this is not a helpful prescription. For these patients, I advise them to jog, but jog that exercises the stomach, not running. In cases of severe discomfort due to acute gastritis, it is good to eat porridge for a few days and gradually increase the amount of food to a normal diet as the condition improves, thereby gradually strengthening the stomach muscles. If you eat a normal diet, it will be uncomfortable at first, but as the atrophied stomach muscles gradually recover, your digestive function will recover. If your digestion is poor, why do freckles appear on your face? A. Freckles are not directly related to your digestive function. Freckles are the melanin pigmentation that you originally have, and they are affected by your nutritional status. If your digestive function is good and your health is good, nutrients such as fat are stored on your face, so freckles are not visible. If your health is poor due to digestive problems, etc., the nutrients accumulated in your body are consumed, so freckles that were covered by fat appear. Also, when you have a digestive problem, skin lesions such as acne appear on your face because your health is worsening, and acne like dermatitis can appear due to parasites and bacteria on your face. When your digestive function is normal, your health improves, freckles will fade, and skin diseases such as acne on your face will usually improve. That's all for today's detailed explanation of gastritis. Thank you very much for watching until the end.